Welcome back to the channel, where we break down complex medical treatments into clear, understandable insights. Today, we're diving deep into a medication that's been around for decades, but still plays a vital role in autoimmune and transplant medicine, Azathioprine. Whether you're a patient, a medical student, or a healthcare professional, this video will give you everything you need to know. Azathioprine, also known by the brand name Imuran, is an immunosuppressant. It's classified as a purine analog, meaning it interferes with DNA synthesis. This suppression mainly affects rapidly dividing cells, especially T and B lymphocytes, which are central to many autoimmune diseases. How does it work? Azathioprine is a prodrug. It's converted in the body into 6-mercaptopurine. That metabolite blocks purine synthesis, which is essential for DNA replication. This targeted suppression reduces immune system overactivity without completely shutting it down. It's a delicate balance. Control inflammation without dipping into dangerous immune deficiency. So when do we use Azathioprine? It's indicated for a wide range of autoimmune and inflammatory conditions. These include systemic lupus erythematosus, rheumatoid arthritis, and vasculitis. It's also used in inflammatory bowel diseases like Crohn's disease and ulcerative colitis. In dermatology, it can treat conditions like pemphigus vulgaris and dermatomyositis. And in organ transplantation, especially kidney transplants, it helps prevent rejection. One of its greatest strengths is serving as a steroid-sparing agent, helping patients taper off long-term steroid use. Dosing is usually weight-based, typically starting between 1 and 3 milligrams per kilogram per day. It's taken orally, and clinicians often follow a start low, go slow approach. It can take several weeks or even a few months for full therapeutic effects to appear, so close monitoring and patience are key. Let's talk side effects. Common ones include nausea, fatigue, mild liver enzyme elevation, and mild bone marrow suppression. More serious risks include myelosuppression, which can lead to neutropenia, anemia, or thrombocytopenia. There's also a risk of hepatotoxicity, pancreatitis, and increased susceptibility to infections. And with long-term use, especially in young males with IBD, there's an increased risk of lymphoma. Before starting therapy, it's now standard to test for TPMT and NUDT15 enzyme activity. These enzymes are critical in metabolizing azathioprine. Low or absent activity can lead to drug buildup and severe bone marrow toxicity. If enzyme activity is low, a major dose reduction or a different drug entirely may be needed. Drug interactions, there are several. A major one is allopurinol, a common gout medication. Taken together without adjusting the azathioprine dose, this combo can cause dangerous toxicity. Other interactions include warfarin, ACE inhibitors, and live vaccines. So, it's essential to review the full medication list before starting treatment. Monitoring is not optional, it's essential. Early on, patients need complete blood counts and liver function tests every 1 to 2 weeks. As things stabilize, monitoring shifts to monthly, then every 3 months. Watch for signs like unexplained fatigue, bruising, signs of infection, or jaundice. And if the condition hasn't improved after 3 to 6 months, a switch in therapy may be necessary. How does azathioprine compare to other immunosuppressants like methotrexate or mycophenolate? Azathioprine is typically used in IBD, lupus, and organ transplant cases. Methotrexate is more common in rheumatoid arthritis and psoriatic arthritis. Mycophenolate is often chosen for lupus nephritis, vasculitis, and certain skin conditions. Choosing the right drug depends on the specific disease and the individual patient profile. What about pregnancy and breastfeeding? The good news is that azathioprine is considered relatively safe in pregnancy, especially in transplant and IBD populations. It does cross the placenta but hasn't been linked to major congenital malformations. Breastfeeding is also generally safe at standard doses, though always review this with your healthcare provider. To wrap up, azathioprine is a powerful immunosuppressive drug with broad applications. It suppresses immune overactivity without completely disabling immunity, but it requires careful monitoring, enzyme testing, and thoughtful prescribing. When used wisely, it can reduce steroid use, prevent flares, and improve long-term outcomes. Thanks for watching. If you found this video helpful, don't forget to like and subscribe for more deep dives into essential medications.